So this will be this is about the third year that I've gone through this. Again, I preface it always by saying that I'm not here to debate the pros and cons of the ACA. I'm just here to give you the basic information that you need. There's a lot of changes coming up for 2016. When I was preparing for this presentation, I was building a nice PowerPoint, and I was going to put up all these slides with numbers and statistics and all that kind of stuff. But out in the third year of giving this, what I realized is there's some basic information that everybody basically wants to have, and then everything after that is really just question and answer type of stuff. So these are the 7 basic things that I'm going to go over today. I'm going to go over COBRA, individual mandate penalties, subsidies, networks, HSAs, exemptions, and open enrollment. If you have any questions, feel free to ask any questions that you have. But other than that, I'll try and move through it fairly rapidly here. So the COBRA piece is important because they've made a couple of changes on the federal level on COBRA and how that relates to signing up for the ACA. So a lot of you that are coming out of Dell, coming out of the tech companies, they're going to subsidize your COBRA for a short period of time. They're not going to tell you this, generally speaking. It's just part of your severance package. So you get your paperwork and your COBRA says your premium is going to be exactly what it was when you were working with them. You need to call and make sure that that's not a subsidized COBRA amount, because what's going to happen is in 90 to 180 days, that COBRA is going to blow up to the full amount. Dell usually gives 3 months. I've seen AMD and Freescale, they give up to 6 months on it. But make sure that when you get that COBRA statement, you're like, oh, that looks great. It's only the same amount that I was paying when I was employed there. That's not, if it's the same amount that you were paying when you were employed there, that's a subsidized COBRA amount, and it's going to change, whether that's a 90 days, 180 days, whatever it's going to be. That's important to understand. The reason that's important to understand is if you elect your COBRA decision and you let 90 days go past and you're still on COBRA and that premium blows up on you and you say, well, now I want to get on an ACA plan because I want to get a subsidy, I want to go to the federal marketplace. You cannot. You have a 60-day window. Remember that the qualifying life event is the loss of your job. The qualifying life event is not the loss of your coverage. So you have 60 days from the day you lose your job, because that's technically the day that you become not eligible for the group plan. You have 60 days from that date to sign up for a subsidy through the marketplace and get on an ACA plan. If you wait till day 61, then you have to wait for national open enrollment to roll around all over again before you can get on an ACA plan or get a subsidy through the federal government. So it's important to understand, and it's a tough decision for you guys because the hope is always that you're going to have a job within the next 60 to 90 days after being laid off. So COBRA is then the best option because they're still subsidizing it. But just be aware that if you go past the 60-day mark and you're still on COBRA, you cannot dump your COBRA and then go back and get a subsidized plan. You can dump your COBRA, but you cannot sign up for a subsidy and an ACA plan after that date. That's why COBRA is important. COBRA is, generally speaking, if it's not subsidized, it's generally speaking not your best option. The other thing that people don't understand about COBRA is as long as you stay on the plan, you can split everybody else off. So if you have a spouse or children or something like that on there, it's generally better to split them off and less expensive to split them off. You cannot leave them on and split you off because you're the primary. You have to stay on the plan. The other thing that you can do is if you want to keep your dental and your vision with COBRA, you can split that and keep just dental and vision and put your medical under a subsidized or an ACA plan. The only reason you would want to do that is if for some reason you have some dental work that's upcoming that you know you're going to have done in the next 90 days, 180 days, something like that. If you stay on the COBRA plan, you've satisfied all of your waiting requirements of 12 months or 18 months for major services. If you dump that plan and go on a private dental plan, then that waiting period starts all over again. So that's something to take into account when you're deciding whether to keep your dental or not. Price-wise, dental and vision is going to be about the same price whether you're with COBRA or whether you're with a private plan. They're about the same price. So the 2016 individual mandate penalties, everybody knows it's an individual mandate. If you don't have minimum essential coverage for 9 months out of the year, you're going to get penalized. The penalty for 2016 is $695 per adult and $347.50 per child. It's capped on a family of 4 at about $2,100. So if you have 9 kids, you're not going to get hit with the individual penalty for every single person. You can go 3 months out of the year without coverage and still not get penalized, provided that you get minimum essential coverage after that. So if you had a group plan and you were laid off and you took a couple months off, just didn't want to pay for health insurance, and then you got back on a group plan, that's fine. What you can't do is just say, oh, well, I had coverage for 3 months out of the year, and I get 3 months for free, so I'm really only going to get penalized for 6 months. It doesn't work that way. You only get the 3 months free if you end up getting minimum essential coverage later on. Is everybody clear on the penalty? The penalty is attached this way. At the end of the year, if you don't have qualified medical coverage, at the end of the year when you file your taxes, there's going to be a $695 per adult tax penalty added to your tax burden. Now, the law states that you don't have to pay that. You don't have to write a check and pay that back. What happens is that amount simply rolls over every single year. There's no late fees and there's no penalties attached to it, but it rolls over from year to year, in which case, if you end up one year where you're going to get money back, they just take that $695 penalty out of it. What I don't know, and I don't know how they're going to address this, if you have your taxes done by H&R Block or Do It at Home with TurboTax and TaxSlayer, there's no way to separate that out. H&R Block is going to get to the end and they're going to say, you have a taxable amount of this amount. And they won't file your taxes until you give that amount. According to the ACA law, that's not the way it works. You don't have to actually pay that at the time you file your taxes. Again, I don't know how they're going to address that, and I don't know what H&R Block and all those places are going to do about it.
Isn't it waived if you're below a certain income?
Yes, but that's when I get to exemptions. So again, just be prepared that if you're having your taxes done by anyone other than a private accountant whom you can argue with, they're going to make you pay that tax burden at the end of the year. Again, that's not the way the law is written, but that's just kind of the way it's playing out. So subsidies is what everybody wants to know. So subsidies are basically government money to help you pay for your health care premiums. They don't help you pay for any of your care. They only help you pay for the health care premiums themselves. And it's based on a sliding scale. It's based upon your income. Now, it's not based upon this year's income. It's based upon next year's income. So if you worked 9 months out of this year and you made $80,000 this year, and then next year you're going to be on unemployment only to start off the year, then that's what matters. Don't use this year's income. It's projected income for next year. Now that's the hard part because it's projected income for next year. So if you're on unemployment or something like that, you're going to roll into the next year. And it's hard because if you sign up now, in November, it's quite possible that you're going to have a job by January or February of next year. And I'll cover that. You're going to have to just go back in and call them and change all of that kind of stuff. But remember, it's based upon projected income next year. So there's two things that can happen with that. The numbers, so for a single person, it's roughly $45,000. If you make less than $45,000 next year, you're going to get some kind of subsidy. It's based on a sliding scale, so if you make $42,000, you're not going to get anywhere near as subsidy as if you make $22,000. And it goes up from there. Family of four, I think it's $97,000. Two people, married couple, I believe it's like $66,000 or $67,000, and you still get a subsidy based upon your income. Now, it's all the subsidy is also based upon the premium that you're going to pay. So if you're young and your premium is only going to be about $150 a month anyway, and you're going to make $38,000 a year next year, you're not going to get much of a subsidy because it's based upon percentage of your income is how they determine the subsidy. Any questions on the subsidy piece? I'm going to move through this pretty fast. If you estimate very, very low income, and then you get a great job, you are going to have to call healthcare.gov and you're going to have to let them know that you had a change in income, and there will be a reconciliation piece at the end when you file your taxes. If you claim that you're going to make $30,000, you end up making $100,000 because you get a great job, they're going to want that money back. Now it's capped. So let's say you get $300 a month and you go for 9 months, you get $2,700 in subsidy. And then you get a great job, you don't have to pay the $2,700 percentage of that, and it's capped at a certain amount for your family size and how much premium you get. So if for some reason you get a great subsidy, you get $500 a month, and you get it for 11 months, you get $5,500, you're not going to owe all of that amount of money back. It's capped at a certain amount, and it's based on a sliding scale, depending on how much you're going to make over what it is that you estimate. Any questions on the subsidy piece? You must go through healthcare.gov. you must apply and have a healthcare.gov account in order to apply for the subsidy. Two things are going to happen. If you're on unemployment only, or if you're a contractor and they're going to send you a notice that says you have 90 days to show us proof of income. Where did you come up with this number? Because there's two things that can happen in Texas. If you fall under a certain number, for a single person, I'll just give you a single person number. If you fall under about $12,800, you're going to fall into what's called the Medicaid black hole, which means that when the ACA was first started, it came with a piece that said, well, all states are going to have to expand the Medicaid ranks to include people of all ages. Well, then the Supreme Court came through and ruled that that was unconstitutional, and they said, well, the states have the right to decide whether they're going to expand Medicaid or they're not going to expand Medicaid. So all of the Republican-leaning states said, we're not on board with this, we're not going to do it, so they didn't expand the Medicare ranks. So what happens is if you make under federal poverty level, which for a single person is $12,800, what the calculator on healthcare.gov is it says, well, you're not eligible for a subsidy because you should be on Medicaid. So then what happens is your application gets automatically sent to the Medicaid office. You wait 45 days and then you get a notification back that says you don't qualify for Medicaid because you're not within this certain age range. So then what happens is you're not eligible for a subsidy because you qualify for Medicaid, but you don't get Medicaid because you're not qualified for Medicaid in the state of Texas. So the trick is to somehow get your income, if you're a single person, between over $12,800 and below $45,000. And there's a couple of ways that you can do this. One of them is if you're maxing out your Social Security, then you should get to about $12,800 anyway. What happens is if you started your unemployment, did I say Social Security? Okay, I meant unemployment. If you're maxing unemployment, you get $462 a week and you're going to get it for 6 months, then you're going to be pretty close to that number. What happens is, if you started your unemployment in October of this year and you really only have 3 months of unemployment next year and you don't know how you're going to get anywhere past that, then you're going to fall very, very short of that $12,800. So there's a couple of tricks and there's a couple of ways around this. And both of these are completely legal. They just take some paperwork and some jumping through hoops. The first of which is, if for some reason you get to that point and you're going to have to pull money out of your 401k or your IRA to live because you don't have any more money, that counts as income. Okay? Pulling money out of your savings account doesn't count because the government can't track it and because they can't tax it. If you're going to pull money out of your 401k, there's a couple of tips and tricks to doing that. So what will happen is you're going to say, well, I need to pull $20,000 out of my 401k next year to cover my bills and to live. So you're going to check the box and you're going to say retirement income and you're going to put 401k and it's going to say how much you're going to pull out. And you're going to say $20,000. So what the computer automatically does is it amortizes this over 12 months and it says you're going to pull out this amount every 12 months. You say, well, wait a minute, I don't want to pull out that amount every 12 months because what I'm really going to do is live off savings, or I don't really need to do that, or something like that. So what's going to happen is the computer is going to say, well, we want proof that you're going to do this. So what's going to happen is you're going to have to call healthcare.gov, and you're going to have to keep calling back until you get a supervisor, because the low-level people aren't going to understand this, and they're not going to let you do it. And you're going to say, look, I want to pull money out of my 401k, and they're going to say, great, how much are you going to pull out? And you say, well, I'm not exactly sure. I know that I'll have to pull out at least $20,000 to live. And so then they're going to say, well, you need to prove that to us somehow. And you're going to say, well, how am I going to prove that? So what you're going to do is you're going to say, well, I'm going to send you a spreadsheet on Excel that shows you exactly how much money I'm going to pull out every single month. That works. Now, what happens, for instance, if you're actually living off savings and you really don't want to pull that money out of your 401k because you're under 59.5 and you're going to hit with a 10% penalty? Well, the trick is that you don't actually have to pull that money out every single month. They don't track it month to month. They only track it when you file your taxes. So, best case scenario, you get a job, you never have to do it, it doesn't make any difference anyway, right? Second case is, you get all the way to the end of the year, you've lived off savings, but now the government's calling you and they're saying, well, you're going to owe all your subsidy back because you haven't pulled any money out. You can lump sum pull that money out of your 401k. It's not ideal. Yes, you're going to get hit with a penalty. But you can lump sum it all at once. So you can pull it out, you can wait all the way till the end of the year to pull any of that money out and live off savings in the interim in the hopes that you get a job in between, in which case it's not going to make any difference anyway. The other thing that I'll tell you is, just because you pull that money out of your 401k doesn't mean you have to spend it. You can automatically just pull it out and turn it around and reinvest it. All the government wants to know is that you pull it out and it shows up as income. Okay? Second way that you can do this is, and this is going to be a taxable event also, is if you have a large 401k or if you have a 401k or a non-traditional IRA, you can convert that to a Roth, which still leaves it within your retirement account. You simply change the taxable status on it, which causes a taxable event because all of that money gets instantly reported as income when you take it out of a traditional 401k or IRA and you convert it to a Roth. Still stays in a retirement account, just changes the tax structure on it. This is all stuff that we can help you do and show you how to do if it makes sense for you. Again, we don't, if you have a large 401k, we don't advise converting at all because that's going to be a lot. If you have $300,000 in your 401k, that's going to be a $300,000 taxable event. Again, all we're trying to do income-wise is get you over that threshold so you're out of the Medicare ranks and into the subsidized healthcare ranks. That's the only reason that any of this matters. So networks, this is a big deal coming up for next year. And listen to me very carefully because this is the way it is. There are no private PPO plans available next year. I don't care whether you go through healthcare.gov or whether you call Blue Cross Blue Shield or whether you call Humana. There are no PPO plans available in Travis, Hayes, or Williamson County, period. There are none available in San Antonio. There are none available in Dallas. There are none available in Houston. They are all gone. Blue Cross canceled theirs first, and everybody else followed suit because they said, we don't want to inherit that book of business. There are no private PPO plans available. Now that I've said that, I'll give you the one exception. The one exception is Scott and White. And I hesitate to call that a PPO because although it's a PPO, you can only go to their people. And you have to live in one of the counties that's serviced by PPO, by Scott and White, which is typically up north. So that is the only PPO available, and it's not a true PPO because it's not a nationwide network, it's the Scott and White network. It does mean that you don't have to get a referral to see a specialist, but you have to see a specialist within their network. Okay? So what you're going to see is you're going to see EPO and HMO. The POS plan was what Humana was calling their PPO. POS means point of sale, which basically means that you don't need a referral. It can still be on a smaller network, but you don't need a referral to go and see a specialist. What you're going to see is EPO and you're going to see HMO. Most people are fairly familiar with HMO. EPO is exclusive provider organization, and an EPO works this way. And a lot of people are selling it as a PPO, but it is not. The EPO works on a PPO network, which means it's a larger network than an HMO network. But it works like an HMO, meaning that you have to get a referral before you go to see a specialist on anybody. So don't get an EPO. Don't let somebody say, oh, well, there's this EPO plan, and it's on the PPO network. That's great that it's on the PPO network. You still have to see your primary care and get a referral before you can go to see a specialist. Okay? So if you're currently on a plan that's a PPO, you should be getting a letter fairly soon, or you've already gotten it, that says your plan doesn't exist, here's some options for you. HSAs, I'm going to go over this just because a lot of people don't understand them. They think, well, I pay my deductible and that's it. So HSAs, not to be confused with FSAs and HRAs. If you had an HSA plan at an existing job, you can take that with you. An HSA is your money. It follows you wherever it is that you go. It rolls over from year to year. It's not a use it or lose it type plan. It's your money. An HSA type plan, only certain plans qualify for HSA status. HSA status, they're basically higher deductible plans. Basically what an HSA does is you can put away money tax-free. And if you're a contractor or you're self-employed, you can put that money away and then claim it on your taxes at the end of the year. It says, did you contribute any money to an HSA that you? And it's capped at a certain amount, but you put that money away tax-free, and then that money can be used for qualified medical expenses. So on an HSA plan, when you go to the doctor, there's no copay. You don't pay $20 or $30 or something like that. You pay whatever the negotiated rate is. So with ARC, it's $91. If you go to the doctor because you have the flu and you go to ARC, the negotiated rate with Humana is $91. So they'll say, you'll get a bill for $91. You then pay that amount out of your HSA. The only savings that you get is you get the negotiated insurance rate, and you get it tax. The money that you use to pay it comes out tax-free. HSAs only work if you're putting money into your HSA. If you're not putting any money into your HSA, the plan's worthless because it's a higher deductible plan and you're going to pay for everything that you go to. HSAs are very good in certain situations, but they're not right for everybody. I wanted to clear up some confusion because a lot of people say, well, wait a minute, I have to pay my full deductible and then I pay the premium. It doesn't make any sense. There's no savings in it. So exemptions. You are not responsible for the individual mandate penalties if you fall under a certain income level. If your income level is so low that you're not going to file a tax return. If you're a Native American, if you are incarcerated, and there's a couple other of them too. The main ones are, so in the state of Texas, and this goes back to the Medicare thing, if you fall in that level and you get declined for Medicare, that counts as a hardship exemption. But it counts as a hardship exemption essentially because your income level is below 100% of federal poverty. But you are exempt. So that is a choice that you can make. If you're going to be, you can decide to try and get to that $12,800 with income and get subsidized health care, or you can just say, forget it, I don't want health care because I'm not going to get penalized anyway. That's a decision that's up to you. Open enrollment this year runs from November 1st to February 28th. If you sign up between November 1st and December 15th, your coverage is going to start on January 1. There is no open enrollment coverage you can get that starts prior to January 1. It all starts in January 1. If you sign up between December 16th and January 15th, your coverage will start February 1. If you sign up after January 15th, your coverage is going to start March 1. So remember that. Anything that you sign up for now, even if you sign up on Sunday, your coverage isn't going to start until January 1. Any questions? That's kind of the short, condensed version. Any questions, feel free to contact me. I don't have any cards, that's why that's up there. So if you want my contact information, I advise you to copy down and take a picture of it, because I think I'm out of cards back there. So again, that's the condensed version. I may come back and do the longer one later if need be.
Thank you.
Sure.
Thank you so much.
I don't know, maybe.
It's a different era.
Just be very, very sure. Oh, one other thing I want to go over. When you're looking at your plan and you're looking at deductible, they did two things. It used to be you had an individual deductible and you had a family deductible, right? So me and my wife Tanya were married. We each have a $1,000 deductible, and then the family deductible is $2,000, right? So I break my leg and my bill is $2,000. Under the old plans, because I satisfied my deductible, which is $1,000, the next $1,000 is then covered under the co-insurance, right? What they did when they changed the plans is there is no such thing as individual deductible anymore. It's going to be listed on there. You'll see individual deductible and you'll see family deductible. But if there's more than, the only time the individual deductible applies is if there's only one person applying. What the insurance companies did was they changed the plan so that if we have a $1,000 deductible and we have a $2,000 family deductible, the $2,000 family deductible has to be met, whether it's from one person or whether it's from the family, before the insurance company pays anything. So if I break my leg and it's $2,000, we pay the family deductible before insurance companies pays anything. Be very, very careful because some plans are this way and some plans are the old way. So a lot of times, if there's a huge discrepancy in price, you're looking at the price and you're like, well, I'm going to sign up for that plan because the premium is $80 a month lower. There's something that's not right. Remember that all of these plans have to meet a specific percentage of coverage. Every gold plan out there has to cover 80% of the anticipated medical cost for an average 40-year-old male in the United States. How the insurance company builds their plan to cover that 80% is entirely up to them. And Blue Cross Blue Shield's actuaries look at it differently than Humana's actuaries. So there's something in there. If there's a huge difference in deductible, so for instance, there's a Humana plan out there that's a platinum plan with a zero deductible, $1,500 out-of-pocket maximum. And then there's a It's cost X amount of dollars. And then there's a United Healthcare plan out there that's a gold plan that's zero deductible, $3,300 out-of-pocket maximum, right? So you would say, well, the gold plan is cheaper and it's the same deductible. But understand that if something happens on the United Healthcare plan, you're going to pay $3,300 first, because that's your out-of-pocket maximum. Whereas on a Humana plan, you're only going to, if you have a heart attack, you're only going to pay $1,500. So it's very important that you understand the difference, and you understand, remember, co-pays do not go towards your deductible. If you go to the doctor and it's $30, you go to a specialist, it's $60, that has nothing to do with your deductible. It goes towards your out-of-pocket maximum, but it does not go towards your deductible. Okay? So be very, very sure. If you have any questions, feel free to call me, and we'll walk through the plan, and I'll explain to you exactly what it is you're going to get and what's going to happen if something happens. All right?